President, General Secretary, thank you very much for the invitation on behalf of the Minister. Minister Reilly will be very pleased to meet with you on an early date to consider the issues that you want to raise with him. And I can assure you and Secretary General Doran that my office will be available to you to help in any way we can to move the agendas forward. The script I'm reading is Minister Reilly's script, and I would like you to bear with me. He genuinely would wanted to be here. In fact, a few minutes ago I spoke with him by telephone and he asked me to convey to you his sincere thanks and his regrets, and he looks forward to being at conferences in future. Okay. The INMO is one of the largest organisations in this country, and it represents the largest cohort of healthcare workers in the health service. It is important that we engage with each other as we continue to provide the best possible care to the Irish population together. One of the major lessons I learned through my time in politics is that governments alone cannot solve the world's problems. Last year I announced that I would establish a new Chief Nursing Officer role within the Department of Health at Assistant Secretary level. As you are all aware, Dr Siobhan O'Halloran has now been appointed to the post. It is critical that nursing and midwifery plays a central role in the implementation of the health reforms. The appointment of Dr O'Halloran as the first Chief Nursing Officer at this level in the Department of Health, and I want to thank Liam for putting a lot of pressure on the President, for putting a lot of pressure on the Department to get on with the appointment, and to thank them for their support. The Department has to ensure that with Siobhan's assistance that the voice of nurses and midwives is represented at the highest level in terms of policy making within the health service. This appointment greatly strengthens policy deliberations and ensures that dialogue and collaboration between nurses and midwives and policymakers can be sustained over time. Now, strong leadership is required and needed for problems that do not have easy answers. With this in mind, I am of the view that the Chief Nursing Officer should be supported by specialist nursing and midwifery expertise in order to maximise the contribution to health reform. I am therefore pleased to announce that the process of recruiting 3 new Deputy Chief Nursing Officers is underway. All 3 posts will focus on all divisions of nursing and midwifery, and the 3 general areas for which the Deputy CNOs will have respective responsibility are patient care and systems, women's health and primary care services, and nursing and midwifery policy and legislation. Dr O'Halloran and her deputies will have a vital role to play in the implementation of the health reform programme. The programme of reform currently underway represents the most radical overhaul of the Irish health service since its inception. Given the magnitude and complexity of the reform programme, it is not something that can be implemented overnight, and often there is a perception that progress is slow. However, a great deal has already been achieved, such as the publication of the White Paper on Universal Health Insurance, the publication of the General Practitioner Service Bill, and the appointments to the hospital group boards, which are expected to be completed shortly. As you know, it has been necessary to reduce the numbers of staff employed in our public health system in order to contain health service costs, and nursing has not been immune to this measure. However, it is imperative that patient safety continues to be maintained in the context of these reductions. Deciding on an optimal number of nurses is not easy, as it sounds. As you can appreciate, there is a delicate balance to be struck between having an efficient number of staff and a safe number of staff, and achieving this requires relevant expertise. It is for this reason that I have approved the establishment of a task force to develop a framework to determine staffing and skill mix requirements for the nursing workforce in the range of major specialties. The focus will be on the development of staffing and skill mix ranges which take account of a number of influencing factors. Phase 1 of this project will focus on developing a staffing and skill mix framework related to general and specialist adult hospital, medical and surgical care settings. The task force will be chaired by the Chief Nursing Officer and will comprise various experts, including representatives from the INMO. The use of staffing ranges as opposed to staffing ratios will retain flexibility in the system while ensuring that the safety of patients, which is clearly a central focus of the nursing profession, as illustrated by the theme of this conference. As a vital part of the health service, nursing and midwifery is very often in the spotlight, and I want to assure you of this government's commitment to creating a better environment to support nurses and midwives in performing their tasks to the highest standards, particularly in the context of the health reform programme. However, the findings of recent reports, including the HICWA report into the care and treatment provided to Savita Halappanavar and the report of the Chief Medical Officer into Portlaoise, demonstrate that we still face many challenges to ensure that our health and social care services are truly safe and of the highest quality. I am confident that the recommendations of both of these reports, which are currently in the process of implementation, will ensure that patient safety is everybody's priority. And I want to reassure patients that the services they access are of the highest quality and safety. There is no doubt that when things go wrong, it can hurt the morale of all clinicians, including nurses and midwives, and we can often lose sight of how hard people are working to do what is right. It is important that we learn from these tragic events to ensure that we continue to provide care in a health system that is increasingly proactive rather than reactive. We must ensure that systems are put in place to reduce to the absolute minimum the chance of an adverse event occurring, and we must also ensure that if such an event occurs, its impact is negligible. I have accepted all of the recommendations in the report in respect of Portlaoise. One of those recommendations is the HSE should develop evidence-based workforce planning tools and data systems for midwives and maternity care assistants using Birth Rate Plus. I am committed to addressing staffing issues, and Birth Rate Plus is analogous to the aforementioned task force on staffing and skill mix, but is specific to midwives and maternity care assistants. Progress is being made on this initiative, with data being gathered beginning shortly. It is anticipated that a report will be available in the autumn. My department is continuing to develop proposals on the organisational structures needed to improve health safety and patient safety in our system. We are liaising with the Health Service Executive on the details surrounding the establishment of the Patient Safety Agency. Although patient safety is paramount, it is also important to recognise the wider patient experience. Since this government came to power, there have been concerted efforts to reduce the numbers of patients on trolleys in emergency departments daily. By the last Friday in April, there were 213 patients waiting on trolleys, year to date versus the same period in 2013. Even more strikingly, there are close to 10,000 fewer patients on trolleys in that 4-month period in 2014 and in the grim figures recorded in the first 4 months of 11. But this is not a numbers game, despite what the headlines would have us focus on. This is about quality patient care. International evidence tells us that where patients spend lengthy periods of time on trolleys in overcrowded EDs, these patients have poorer experiences and poorer outcomes. Whereas moving patients to other areas within the hospital is preferable to the risk of severe overcrowding, it is not a solution. The introduction of Ward Watch has allowed us to focus on this as an issue. It is welcomed by my department and the SDU, and I am confident that the INMO will continue to work with the SDU on their solution-focused approach to minimise the use of non-designated bed spaces to accommodate patients. Taking all of these problems has required a system response, improved patient pathways in ED, better working across nursing teams, and better working across multidisciplinary teams. Whilst the reduction in trolley numbers is very welcome, we need to shift our focus to improving the patient experience in ED. The National Patient Experience Time Standard is that all patients will complete their episode of care in under 9 hours, and 95% of patients will complete their episode of care in under 6 hours. Achieving this standard is a challenge. Of those attending, on average, 78% will be assessed and discharged, with the remaining 22% requiring inpatient admission. However, with the introduction of medical assessment units, minor injury units, and other streams to manage patient pathways, and by ensuring that low acuity patients who generally will not require admission are focused on, I think we will begin to see the same significant beneficial changes we have witnessed in terms of trolley reductions. We have seen what can be achieved. At the end of 2013, 99% of all inpatient and day case targets and 95% of all outpatient targets were met. But without your engagement, your dedication, your professionalism, and your willingness to challenge the system and identify its flaws, everything I've described would have been aspirational. Now, since commencing the Nursing and Midwifery Act of 2011, my department has been working with the Nursing and Midwifery Board to give full effect to the new legislation. I am particularly pleased to see that the development and implementation of standards and requirements for education programmes to meet the current health reform programme is at an advanced stage of consultation. I made provision in the Nurses Act and Midwives Act for a statutory midwives committee of the board, and I'm pleased that work has commenced within this structure to revise and update practice standards of midwives. I understand that this will address the skills required by a midwife to maintain professional competence to the satisfaction of the board. The standards and requirements for education as a midwife are also being examined to ensure that future midwives will be prepared to meet our evolving health needs while learning from the lessons of the past. The board will consult with you later this year, and I understand the board have consulted with you in respect of a revised code of professional conduct and ethics and a revised scope of practice. Developing the role of the nurse and midwife to support safe access to efficient health service is one of my priorities. In this, I am pleased to say that the board now has 6 advanced midwifery practitioners and 134 advanced nurse practitioners registered, and that a project to review and support this development further to maximise the skills of nurses and midwives is currently being advanced. I have asked the board to prioritise the development of rules to support the maintenance of competence by nurses and midwives. I believe that mechanisms to assure the maintenance of professional competence will help support you as practising clinicians in the delivery of safe care. I want to also now deal with the issues about leadership. Building the leadership capacity and capability of nurses and midwives is essential to delivering a reformed health system. The HSE has invested in providing leadership and innovation for nurses and midwives to support them to play a key role in leading our reform agenda. Since the establishment, under the Office of Nursing and Midwifery Services Director of the National Leadership and Innovation Centre for Nursing and Midwifery in 2011, 1,470 nurses and midwives have engaged in various programmes and workshops, with key initiatives such as the recent Future Nurse Leaders programme for 74 assistant directors and directors of nursing and midwifery. In response to the service needs, the NLIC will be facilitating the delivery of leadership programme delivering quality through midwifery leadership to support 60 senior midwives commencing in September of 2014. Now, nurse and midwifery product prescribing. This continues to grow from strength to strength, and there are approximately 660 registered nurse prescribers in this country. This role enhancement across diverse clinical specialties contributes to more timely patient and service user care. This is a truly collaborative, innovative and successful initiative. I want to see nurses and midwives taking an enhanced role through the health system. As I outlined earlier, as part of the reform programme, there will be a renewed focus on treating people in the community as opposed to hospitals. There is no getting away from the fact that this will have repercussions for community and public health nurses. I acknowledge this, and that is why I am particularly pleased that 107 public health nursing sponsorships have been approved in 2014. This represents a significant increase in sponsorship places, the highest number of sponsorships since 2008, a 26% increase on 2013, and a near 70% increase on 2012. Now, since last year's conference, the Haddington Road Agreement has been concluded. The agreement requires further pay adjustments in order to correct the public finances to achieve pay savings, and in order to minimise these, a range of productivity measures such as additional nurse hours for nurses and midwives are required to work. I understand that many demands have been made of you, particularly given the reductions in the numbers employed in the health service. It is imperative, given the reduced health budget and the reductions in staffing that have occurred, that cash savings and productivity gains are realised. I am pleased that the negotiations resulted in a number of positive outcomes for the nursing and midwifery professions, including the regularisation of acting up posts, the restoration of the senior staff nursing scale. The agreement provided for the recruitment of up to 1,000 nurse graduates on a 2-year programme. Although the programme attracted some criticism, it has proved popular, with around 500 nurses and midwives having commenced employment on the programme and over 200 others going through the recruitment process. More broadly, the agreement also provided for the assimilation of the 10% reduced new entrant pay scales with the pay scales of those who entered service before January 11. These revised scales have now been issued by my department. I'm also aware that under the agreement, the HSE and the INMO are now engaged in a process with the support of the LRC in relation to the national nursing midwifery management structures in the acute, primary care and elderly care sectors appropriate to the new healthcare framework. I do appreciate that nurses and midwives, in common with many professions in the public service, have made many sacrifices over the course of the last 5 years. I am satisfied that we now have an opportunity to focus on putting in place firm foundations for the future of our health service in the context of the establishment of hospital groups and integrated service areas and the move to universal health insurance. Now, each one and every one of you makes a huge contribution on a daily basis to the health service, and it is unusual, therefore, to select one group of nurses for special recognition. However, in recognition of both their contribution to our health service and their difficulties and tragedy their country has faced following a devastating typhoon, I am delighted to announce that I have approved the initiative which will allow 8 Filipino nurses return home for 4 weeks on full pay to undertake frontline relief work. Now, firstly, I want to commend the nurses themselves for volunteering for what will be a very challenging but ultimately rewarding role. Secondly, I want to congratulate the President and the Secretary General in this organisation on its fundraising efforts and the Nurses and Midwives of Ireland, who have ensured all travel, hotel and living expenses for the volunteers will be covered during their stay. The support you have given to your colleagues from the Philippines, both on a personal level and through disaster relief donations, has not gone unrecognised, and to ensure that you were supported during this initiative, that volunteers' posts will be filled for the first 4 weeks. I'm sure you will join with me in wishing the volunteers the very best of luck with their endeavours. In concluding, I would like to take the opportunity to acknowledge the manner in which the nursing and midwifery professions have ensured that health service delivery has been maintained and in many instances significantly improved in recent years, notwithstanding the challenging circumstances brought about by reduced budgets and reduced staffing levels. I know because of your campaigns and leaders that we are making progress. The department are aware that nurses and midwives want the best possible care for their patients and the resources to provide it. I am committed to putting in place the structures that would enable you to do so. I wish you all well for the remainder of your conference and in bringing and providing healthcare to the Irish people in the year ahead. Thank you very much.